As the silent pandemic because kidney disease affects so many people and many don't even know they have it. Joining us with who should get checked and options if it's progressed, Dr. Brett Stephens is with Humble Vascular Surgical Center. Good morning, Dr. Stephens.
Good morning. Thank you.
We say the silent pandemic because millions of people have it and don't even know it, which suggests that there's not always symptoms. And if there are symptoms, maybe it's progressed. What would symptoms look like?
Symptoms don't really develop until the later stages of the disease. Generally, when kidney functions about 10 to 15% of normal, will patients start to have very non-specific symptoms, including fatigue, loss of appetite, sleep disturbances.
And one way to deal with it would be a kidney transplant, but there's issues with that.
Correct. Kidney transplants generally the best option, but we have limited supply. So patients have to remain on a waiting list for several years at times until a kidney becomes available. But during that time, they can undergo dialysis.
Yeah, and that's one of the things that you all do so well. Yeah, I'm sorry to interrupt you, but that's one of those things that you all do too well. So two types of dialysis.
Correct. The first is called hemodialysis. It involves taking blood from the patient, running it through a machine where the machine will clean the toxins and the excess fluid and give the blood back to the person. The second type is called peritoneal dialysis, and it involves instilling fluid into the abdomen, into the belly cavity, and that fluid will allow toxins to diffuse from the body into that fluid, be drained out, and then clean fluid is replaced.
Yeah.
And both options are very good. It really boils down to patient lifestyle preference.
Yeah, and both options require, I guess, access, and so the AV fistula is one way to access and give dialysis.
Correct. This is generally the best access option for hemodialysis. It involves the connection between an artery and a vein, your own artery and vein, to allow a big enough vessel and high enough flow to undergo the procedure. An AV graft is similar. It's a synthetic tube that goes under the skin that makes that connection for you. And we typically use it in patients that may not have the best size or caliber of veins. And then we have a catheter, an external catheter, that goes in near the collarbone into a large vessel. And it's used in acute settings until one of the other two longer-term solutions are available.
These are lifelines that have to be maintained.
Correct. They are prone to developing clots and blockages and other dysfunctions. And so we specialize in taking care of these problems, from new creations to maturations, to maintenance and revisions of these accesses whenever problems do arise.
Yeah, and it's important what you said, we specialize. Just kind of explain to people what umbilical vascular is, because this is your specialty.
Correct. We are a dedicated surgical center, and we dedicate 100% of our time to management of these dialysis access centers. We have 3 physicians. We have over 25,000 cases performed. So we have a lot of experience in this type of disease process. We pride ourselves on patient safety and good outcomes with all that experience.
We have a staff. We talked about dialysis today, but your staff is dedicated to all types of vascular care, including peripheral artery and venous diseases.
Correct. So if a patient has any type of vascular disease, we have specialists here and staff equipped to help those patients.
And protocols in place, as you mentioned, because I know a lot of people will have anything in our head to delay something that's medical, right? But all your protocols are in place in terms of COVID. People don't have to be afraid. You also can keep families safe, because oftentimes there's a family member who's bringing someone for treatment.
We've remained open during the COVID pandemic. We do have strict protocols in place to ensure everybody's safety, patients, their families. Or isolation protocols, cleaning protocols. We keep the patients out of the hospital, so it really minimizes their exposure.
Yeah. Dr. Stephens, thank you.
Thank you.
Now through the end of March, Humble Vascular Surgical Center is offering a free test that can reveal poor blood flow in the access for dialysis patients.